A 57-year-old Hispanic female after ED admission for adrenal crisis. She had no prior diagnosis of adrenal insufficiency. She saw PCP for her fatigue, nausea, increasing frequency of urination and diarrhea, abdominal upset, and paresthesia 2 weeks prior to this crisis. The provider at that time did not make note of her hyperpigmentation, I suspect likely due to her Hispanic ethnicity. When I saw her, her fair-skinned daughter was present and able to described that her mother had darkened pigmentation skin. So this patient presented in the ER with very classic symptoms. She was hypotensive, hyponatremic, hyperkalemic, and an extremely elevated ACT, which you can see here, 2600. So we continued her care of her adrenal insufficiency and hypothyroidism, educated her on an elevated A1C level. So I was curious about when you do have a new diagnosis of adrenal insufficiency, how do you prepare that patient for this chronic condition? The patient that I saw had a lot of questions. Could she return to work? Was everything okay? Is she going to be in danger? So patient education is a hugely important tool in adrenal insufficiency. I wanted to see if effective patient education tools help to reduce the rate of adrenal crisis. I did find one study that examined just that. They looked at 423 patients over a period of 2 years, providing a questionnaire over glucocorticoid dose adjustment every 6 months for the participating patients. What they found was that the patients experienced adrenal crises most often due to GI infection, fever, and emotional stress, though other causes were seen as well. The only risk factor they identified as an indicator for repeat adrenal crisis would be a prior adrenal crisis. And what they found in conclusion was that actually the rate of adrenal crisis occurrence did not decrease with this education evaluation. They had a prior study done at the same institution on the rate of adrenal crisis on post-adrenectomy patients, and it was not significantly different. I found the study to be valid as the patients were provided identical education materials and assessment tools, and it was published in a peer-reviewed journal, and this area of study is important as patient education is an important tool in adrenal insufficiency patients. Some limitations would be a small sample size, a little bit of selection bias, as only 46% of the invited patients participated. Some strengths being including primary and secondary adrenal insufficiency etiologies, some other weaknesses being things like this was done in Germany. They have a national social health care program, likely increasing the access to primary care in the first place. I would say the implications of this study encouraged me to use more than one modality of patient education in adrenal insufficiency.